Orthopedics, the shoulder, humerus. Here's case number one, a huge bodybuilder, 120 kilograms with painful shoulders. The problem is to do an arthroscope. The point fixation, the skin or the center of the muscle mass and at the capsule. So it makes it very hard to move the scope. And previous surgeon was not able to do it. So what would be your advice? He's been working out in the gym. Now you're going to be working out in the operating room. I think he needs an open technique. Rush pin technique for fractures of the humerus and other fractures. I found it very useful. Spiral fracture couldn't be held with the cast. I put 2 rush pins in from lateral epicondyle from the top, went on the bony union. It's a great technique. You should read Leslie V. Rush's book, wonderful book, Fracture Problems, showing how to use this technique for just about every fracture. I worked with a consultant and used it for just about every fracture, and it really does work. I find it incredibly effective. Here's another case, transverse fracture of the humerus. Breast CA, I did a biopsy, it was clear. I put 2 pins in from the bottom, went on to bony union. She did have a radial nerve palsy that persisted. We did an MRI, and I'm leaving it in the hands of another surgeon whether to explore that at this stage. Here's an OA of the shoulder, asymptomatic. I will leave that at this stage. Here's a large calcium deposit in the rotator cuff. These are very hard to deal with. You open it up, it's like toothpaste, just goes everywhere. Then you've got a large defect in the rotator cuff. I tend to use a small or mini incision technique. What would you do? Here's a non-union clavicle, 38-year-old male, painful. I bone grafted it, used OP1 and bone graft. It went on to union. Here's another non-union clavicle, 41-year-old male, asymptomatic despite the X-ray appearance. Here's an OA of the glenoid, no trauma. Wonder what caused this. Confirmed with CT. No surgery required. Here's an interesting case, 38-year-old female nurse. She had previous fracture surgical neck, closed reduction, got 10 years previously, went on to bony union, slight varus, a good position. She's happy with that. Here's a patient with hypertrophic arthritis of the AC joint, quite painful, exuberant OA. We're going to do a limited arthrotomy and osteectomy. Here's another case of a fracture midshaft humerus, 40-year-old sailor. 2 rush pins put in, 1 from the bottom, 1 from the top. And here's the technique, another case of midshaft humerus, 50-year-old fell at a party. Small incision of the greater tuberosity, putting the pin in. It's very easy to put the 2 pins in via the greater tuberosity, very simple technique. Here's another case of a painful shoulder, 47-year-old, labral tear or slap lesion debris at arthroscopy of the shoulder. I hope you find these cases interesting, in particular the rush pin technique. Please note it's a very good technique for a fracture fixation.